question here is this. Now, you talk about stories about long-term health care for the individual. What about the information can you elaborate on as far as loved ones who is responsible for the care of the individual, like getting information of finding the right facilities that's needed, or what is the person's rights if a person has power of attorney or guardianship over the individual? Can you elaborate how the Department of Aging can assist, or how local and state agencies can assist people as far as just pretty much getting information for some loved ones who's caring for the individual?
Right. The information and the assistance and support begins off obviously with the doorway or the entrance, the access point. That's why we wanted to integrate it to begin with, because right now if you need any care or any support, and it mostly happens, like I said, in a crisis. It happens when you're in the hospital and you're about to be released or out of rehab, and you need to get home, and where are those supports? So we've tried to integrate the access points so people don't have to go to 10, 15, 20 places, fragmented places, to find one or two kinds of support services, which is the case, and it continues to be the case. We're not there yet. Like I said, these are programs that we have invested in piloting, and that's why I say there's a sense of urgency of ratcheting this up. The second layer behind it is what's behind that, what we call the Aging and Disability Resource Centers and the network support out of the Older Americans Act. And there's a whole array of services that runs the gamut of the traditional home and community-based care, but we run the legal services program, a free legal services program throughout the country that provides attorneys to help people deal with critical issues, including obviously looking at their wills, looking at their advanced planning, and assisting people in managing their care, their assets, etc. Also, we work with the Adult Protective Services folks, which are really run out of the Administration of Children and Families and my counterpart. But in many states, the beauty about the work, the services, including elder abuse prevention programs. We run the National Ombudsman Program, in which we have ombudsmen in every single community in this country. They're like heroes. They're incredible volunteers and people in the community that help us and help our seniors manage problems that they're having with either facility-based care or home-based care services. We've also invested tremendous amounts under the Centers for Medicare and Medicaid Services, my sister agency at HHS, to upgrade the quality standards for both nursing home care and home health care in the country. And we're partners in that. There's also a whole array of supports to try, one of the biggest problems or the biggest challenges for elder abuse and neglect in our country is due to frailty of people and really the lack of information that people have on the supports that are available. So that's why I call it the best kept secret, but it's a very important resource that you can turn, everyone can turn. This is not a means-tested program. This is not an entitlement. The only eligibility is that you be 60 years of age or older, or that you are a family caregiver, or an informal caregiver that are taking care of an older individual. We also serve, of course, Alzheimer's patients and their complex needs, including home care, but it also includes some of the legal and right representations for people. I don't know if you're aware, but during the reauthorization of the Older Americans Act, many of the provisions that are in the Elder Justice Act were integrated into the Older Americans Act. That includes better integration between, for instance, pension counseling programs, the legal services, the ombudsman programs, and then all the protection and support to keep people that are at highest risk because of frailty or just being, the neglect actually reaches every economic sector of our community. It's not just older people. It's people of all income levels in which find themselves into this frailty level and lack of support and not knowing where to turn for help. And sometimes we run into these problems. So yes, these supports are available throughout the country. We're very proud that those provisions made it to the reauthorization of the Act and are an integral part of making this happen. Of course, Benjamin Rose is helping us as part of our national leader teams. We've gathered a team of national experts in aging field to try to help us follow through and implement the latest changes and amendments to the Act, which includes, of course, not only the prevention method, but also all the other supports that are available in the Act.
Ms. Carbonell, thank you for your presentation. My question has to do with the point you so eloquently made that long-term care really needs to be much more greatly emphasized, and the importance of it is because we're faced with a crisis. My question is, and who is the champion for that? Some years ago, we had Claude Pepper in Congress, who was probably known as the person who was the spokesperson on this issue. I'm not aware of anybody currently talking with a bully pulpit nationally in a way that would get the attention for this issue that you're talking about. So I would ask the question, what can be done? And a sort of second question is there legislation needed at this point to push the envelope a little further?
Thank you. That's a very good question. First, we really don't have anything like or anybody like Claude Pepper. He happens to be my congressional district in Florida, and but we have the most important resource, I think, begins with individuals sitting in this room, all of us, of all ages. I think that that's where the action is. That's where I think the face of this issue is. And the families, I mean, how many in this room are either directly being impacted by family caregiving responsibilities or know of someone, with family caregiving responsibilities? So this is really the biggest issue facing us. And I think it begins with us individually as citizens. I said the issue about, this is really of self-interest, rightly understood. We've got a little bit of a stake at this, all of us. I, as a baby boomer, and all of us have a stake in making sure that we get this right. Certainly, at the federal level, the Older Americans Act actually authorizes the Assistant Secretary for Aging to be the chief federal advocate on aging, and that's what we've been doing at least for the last 7 years. And yes, I've aged in place. Longest serving, but yes, I've aged in place, and it's been an incredible experience to be able to work with experts in the realm of housing and in the sciences and National Institutes of Health and the kinds of science and research and developments that are happening in that field. Technology is another field of critical importance to the future. But talking about who would be ready, I think that we've got several leaders. In the Senate Aging Committee, which the Senate has an Aging Committee just tasked with this responsibility. We've got important leaders in those committees, which have tremendous challenges in their own states about the population. You've got Senator Smith, who is the ranking member in the Senate Aging Committee, comes from Oregon. Oregon and Washington has been. These are some of the programs that already have been tested, and in states across this country. So we know that there are cutting-edge states such as Oregon and Washington that have tested important rebalancing of their long-term care system.